Starting from my very own introduction, myself, Hasib Ahmed Sagir, and I am the assistant manager at Royal Psychologist Community, as well as the host for today's webinar as well on counseling skills. So, now let me just introduce all of you to Royal Psychologist Community, what Royal Psychologist Community is and what they have to offer. Basically, Royal Psychologist Community is an internationally registered organization from GIOCP and ICCPP, and it has been created in March 2021. And the founder and the chairperson of Royal Psychologist Community is Mr. Dr. Farhan Qureshi. He himself is a clinical psychologist, a relationship therapist, as well as the founder of RPC Global. So now moving on, Royal Psychologist Community basically offers a variety of short certified online courses as well as workshops, webinars, and conferences. And inshallah, in the coming time, we're actually trying to launch a postgraduate diploma as well. So apart from that, now kindly please kindly turn off your mic, please. Okay, thank you so much. So now, one of the main purpose of Royal Psychologist Community is to raise the global awareness around mental health, that everyone knows that there is so much less knowledge regarding mental health, and people are actually scared to talk about their mental health, on which Royal Psychologist Community is actually working globally, especially in Pakistan, and we actually conduct a variety of workshops and physical webinars as well as workshops in different cities of Pakistan as well. Now, coming to the purpose of why we are actually offering this extensive training program free of cost, that was the question of a lot of people, that if you are offering our services, then why is actually free? So let me just clarify all these things. A lot of our students were basically asking us that they want to get the variety of knowledge, they want to get a diverse knowledge from national as well as the international trainers, that what they have to offer. So this was the main reason why actually we took a lot of organization as well as the trainers on board, so that we make it possible for our students to learn different and the variety of knowledge from the field of psychology. So this was the main reason, and one of the main reason was actually to raise the global and the mental health awareness around all this thing, basically, that we know a lot of people around us are actually suffers in silence, and they have no one to actually listen to them. And this is my humble request to all of you who have actually joined us here and are actually listening to me, that please take care of the people around yourself, especially your family members as well as the friends. If you cannot do anything for them, just be with them, just go with them, just sit with them, just provide them your ears, at least just listen to them. This will definitely going to be a lot for that person, if not a lot for you. So now, moving on, let me just provide a brief introduction about all the organizations who are actually in collab with us. And the organization are, first of all, let me just introduce GIOCP, Global Institute of Counseling Professionals from Sri Lanka, ICCPP from Germany, Heartfulness Organization, Jatan Foundation, Seashore Global Campus, Fountain House from Lahore, Global Health and Equity Club, Park Wellness, and Medical Pro International Academy from United Kingdom, Pakistan Doctors, Amocare from India, Ripple of Change Foundation, Bunny Consultant from Australia, Zunuran Welfare Society, Blooming Souls from again India, uh, Hometown Community Foundation, Soul Healing Foundation, and Serenity Psychological Services. So these are the organization mostly we are in the collab with it. And thank you so much for each and every organizations who actually joined us in this. And inshallah, in the coming time, we're definitely going to do a lot together in the field. So now, Coming to our trainer today, she is Ma'am Soni. She is from the University of Lucknow, India. She is a PhD in psychology, a corporate trainer, a professor with experience of 17 plus year. So warm welcome, Dr. Soni. I think you should take over the meeting now, please.
Thank you so much. Thank you for a very warm invitation and a very good evening from India to everyone who is listening to us from all over the world. And thank you once again. And when we were discussing how to take this session with you all, there was this idea that came up that counseling skills is not something which is new to us. If we are in the field of psychology, we are already aware about the basics of counseling and we already know what counseling is. So, with that perspective, in place of me explaining what is already available to you in books, we thought why not take it on a practical level and ask you right from the beginning what are your queries regarding counseling skills so that that can be resolved right here and right now. So that was the format that we will be following. It is going to be more interactive in nature. And I invite all your questions, whatever comes to your mind when you hear the word counseling skills, you may start writing your questions in the chat box and we'll take it up directly. Hasib,
Yes.
I'll be needing your help with this. So
Yes.
let's get started.
Sure,
Waiting for the
ma'am.
questions. Hmm.
Ma'am, first question, I think I should ask the very first question.
Sure.
Yeah, sure. If you can answer, then just let me know that what is the main goal of basically counseling? What is the main goal of counseling? I want to ask.
Okay. When we talk about counseling and psychotherapy, these are two words that you might have come across whenever you are reading about psychology, and you might be wondering, and many books and at many academic places, there is an interchange of use of these words. Sometimes you see the word psychotherapy and sometimes you see the word counseling, and rightfully so because it's very difficult in real life to differentiate between psychotherapy and counseling. But coming to the academic difference and the meaning attached, when we are talking about counseling, it is an attempt to use the skills, existing skills in a person to help them deal with the problems that they are facing in their life. So, for example, you come across a person who is facing anger management issues. You are going to use the skills that are already there. For example, in some cases. So we are trying to use that skill of assertiveness to deal with the situations in which the person feels more angry. So this is a transfer of skills from one situation to another. There is nothing that is being added to the situation, and generally we call such sessions as counseling sessions. Moving on to the next example, now suppose this person has anger issues because he had problems with his father, and that is the reason why this person is unable to deal with the authority figure in his or her life. So in this case, we are not going to take help via make a person use the existing set of skills, because to start with, the person needs to deal the issue of the father will be resolved. There can be many therapies for that. And then the resultant change that comes is an addition to the existing skills of a person. Now, the person knows something more. This is what psychotherapy does, which is basically a structural change in personality. So this is how we can differentiate academically, I repeat, between counseling and psychotherapy, because when you are working in real life, you really don't know when you have switched from counseling to psychotherapy, because human nature and the way human psyche works does not allow us to follow these academic differences. In real life, when you're working with your clients, you might be switching from counseling to therapy and therapy to counseling. At times, you are using the existing set of skills, and at other times, you are adding something to it. So that was the basic difference between counseling and psychotherapy. Some hands were being raised when I was giving my answers, so I invite those questions now based on what I have told you all. Haji, there were seven hands that were raised. You can start asking your questions. Most welcome.
Madam, as far I know, counseling is emerged from guidance. So, can you tell me about, tell us about what is the difference between guidance and counseling?
One of the major difference between guidance, I really don't agree with the term that guidance and counseling has emerged from guidance per se, but since you have asked about the difference, when you are guiding anyone, you are providing solutions. So taking the humanistic and Rogerian perspective and take on counseling, the biggest differentiation is that counseling is not guidance. You are not guiding anyone. You are not providing any answers or solutions to the client because in counseling, you presume that the answers lie within the client himself or herself. It is only the facilitation process that is required. You, as a therapist, you, as a counselor, has a difficult task at hand than guiding someone because guidance is easy. It is easy to tell someone what to do rather than using the counseling skills and therapy that you have learned to help that person reach their own solutions. That is the challenge that we face actually. Facilitation process is what is differentiating guidance from counseling. Guidance, I again repeat, is easy because you are at an authoritative position. You are telling the other person what is right and what is wrong. You are also, in a way, giving answers. Now, let me mention here, sir, that when we talk about psychotherapies, also, there are certain therapies which require a more active role on the part of the therapist. For example, the narrative approach. So, there are certain therapies also in which a more active approach, or if you can allow me to call it guidance, is required on the part of the counselor, but generally most of the therapies require the counselor to take a facilitator approach where the client is reaching their own solutions, and it also makes sense because you hardly meet your client for 14 to 18 hours at the most. We don't have clients who come to you for more than these sessions, and they have lived their life for 20, 30, 40 years, 50 years, 60 years. You really can't understand a person's life in 14 hours. So it is, I mean, हम अपने आप को खुदा मान रहे होंगे अगर हम ये सोचेंगे कि 14 घंटे में हम किसी की 60 साल की जिंदगी समझ लेंगे. The person is that individual is the only person who knows where the solution lies. Hence, our task becomes even more difficult because we cannot advise.
Excuse me, ma'am, can I ask a question?
Haji, sure, sure.
I just wanted to ask that if a person is facing like social anxiety due to PTSD, so
Okay.
can it be cured using psychotherapy or counseling?
Psychotherapy. Psychotherapy. Understand whenever you are bringing. Uh, there are two mics. Can someone please? Huh. Okay. Okay. Yeah. So the question was whether we can deal with social anxiety through psych. Why am I hearing my voice twice? Hasib, can you please help me? If someone can please mute their mics. Hamidji, I think your mic is on. If you can please mute yourself. Your intervention is
Kindly turn
required.
off your mic, Hamid, if you are hearing us.
Okay, thank you. So the question was whether
Okay,
social
thank you.
anxiety due to PTSD, that is post-traumatic stress disorder, can that be dealt with counseling or psychotherapy? I would say psychotherapy because when you use the word post-traumatic stress disorder, obviously, whatever the resources of the persons were, they were not sufficient to for the person to deal with that traumatic, stressful situation, and hence they have taken its toll on the mental health of the person. So, since the existing sources were not sufficient, we need to add something to it, and since social anxiety is something we were unable to deal with, psychotherapy is going to be the right word rather than, like you said, whether we can use counseling or psychotherapy. Definitely, whatever you are doing will be under psychotherapy because existing resources will not help you deal with the situation. You'll be adding something to it. For example, if you're using hypnotherapy, I'm using the word hypnotherapy because it is a part of your future sessions also. You'll get to know more about it through other trainers. So, for example, if you're using hypnotherapy and trying to understand the cause of that social anxiety, if it is PTSD, it can be many other reasons also. So you are adding that knowledge that the client would gain as a result of hypnotherapy. And through it, the problem will be resolved. Again, like I said, don't get too involved in counseling and psychotherapy if you are a practicing counselor. We need to know these terms better if we are into academics, when you are required to teach others. But if you are working, if you are in the field, it hardly matters कहाँ counseling कर रहे हैं, existing set of skills का use कर रहे हैं, कहाँ आप add कर रहे हैं, because I'm sure more of every one of you is aware about positive psychology, and positive psychology in itself is using the strength in a person that they're already there, along with providing more information through the therapy that they are using. So that use of strength itself is counseling, and that addition of knowledge through the therapeutic techniques that are being used is psychotherapy. So don't get too much involved in what psychotherapy and counseling is. It is very important to know that what you are doing as a person so that your interventions can be planned better. You should know when you are using the existing skills and when you are required to add skills in the client, because when you are adding in skills in the client and when you are giving homework sessions to your client, you need to, because this is something new, right? So the person has to learn to inculcate those skills in their day-to-day behavior. So this is the reason why you will be incorporating the new set of skills into their homeworks also. जो homework आप बीच-बीच में हर हफ्ते दोगे. So that is the only reason why you need to be aware of these differences. And as a therapist, be aware, be in the know. When you are practicing, please go with the flow.
Excuse me, ma'am.
हाँ जी.
For example, if a person with social anxiety, whenever he goes in any social gatherings,
हाँ
he
हाँ.
gets panic attacks, and that panic
हम्म
attack is as hard that he or she gets offending episode with that.
हम्म
So
हम्म.
I just wanted to ask that should that person avoid going to
No,
social gatherings, like
नहीं.
whenever he okay.
Because you can't avoid these social anxiety episodes. If they are not treated at the right time, they will be they can get scattered over other life dimensions also. Okay, so in place of avoiding anything, yes, when the person, and since the person has already reached you, the person is there with you. uh, when you are giving therapy for a while, you can ask the person to practice the skills that he or she has learned in a relatively safer environment. मतलब अभी आपको लग रहा है your client has not really learned the skill, तो उसे ये मत कहिए कि 1,000 लोगों की पार्टी में चला जाए. Yes, the person can go out, have a drink with a friend, or I can have a cup of coffee with a friend, and उस social situation में कैसा feel हो रहा है अपने skills को use करते हुए, and then one by one the ways in which the skills are being used can be expanded. So don't ask the client to miss out on their social life. But when they are there in your therapy, when you are asking them to practice these skills, obviously the person has is fearful of these social anxiety attacks. जब तक confidence build नहीं होगा, वो 1,000 लोगों के बीच में खुद भी जाना नहीं चाहेगा, and that is the reason the person is coming to you to start with. So ये मत कहिए कि मत जाए, but controllable situations में people he is comfortable with, उनके साथ धीरे-धीरे practice करना शुरू करें. This is something that we also use in a different form altogether, but we are using it in behavioral therapy also. धीरे-धीरे हम उसको step by step difficult assignment देते हैं, graded task assignments देते हैं, तो उसके थ्रू आप उनको धीरे-धीरे थोड़ा सा उनका टास्क टफ करते जाइए, बट उनको रोकिए मत कहीं भी जाने से. रोकना is not the solution. We are not
Yes,
there to
ma'am.
stop them.
Yes, ma'am. Uh, it's been years. Whenever I start going to the
Mm-hmm.
university,
Mm-hmm.
I get panic attacks,
Mm-hmm.
and all the faculty and everyone say to quit it. Then
No.
3 times I quit the university due to panic disorder. But I know I have been going to a psychiatrist, and
Mm,
he also saying that if you are scared of aeroplane, then you cannot stop going there. You have to be there to get out of that situation. But the people around me, they are just like that, don't go, you are getting attacks, you are falling, you will get
mm,
hurt,
mm,
you will
mm,
get this
mm,
and that, and these type of
mm,
things. But it's really my wish to pursue my education, and it's been in 2021 I did my inter, and
mm,
now I'm like kind of very stressed. Like I switched 3 university. First I was doing space science, then I started
mm,
mathematics, then I started physics, then the last university faculty also started me to not come to university, and they are like, because when I faint due to panic attacks, they make it
mm,
like uh, something big has happened. They are not understanding, I don't know why. Or even sometimes the family got concerned that you should not be going, you should be taking rest, though I'm taking a lot of medicine, tranquilizers, and because I have a social anxiety due to PTSD disorder with panic
mm,
disorder.
mm,
So
mm,
I just wanted to ask, I want to get out of this, and I just want to pursue with my education, with my goals,
mm.
with my aim. So the it seems like sometimes it seems like that the treatment of this is not possible. So
No,
because
no, it's very
everyone,
much possible. It's very much
so
possible, Sayeda. My solution or rather suggestion to you is, okay, fine, please continue with the medicine, whatever are being prescribed. I won't comment on that. Being a psychologist, I'm not a psychiatrist. But definitely, I would ask you to request your psychiatrist to give you some kind of therapy through a psychologist, because generally a clinical psychologist and a psychiatrist, they work as a team. The psychiatrist is responsible for medication, and you also need therapy. Only medication won't help you. Medication would help you to get grounded into reality, but after that, in order to deal with the issues that you are facing, you need therapy. And for that, you need a psychologist, not a psychiatrist. Psychiatrist cannot give you therapy. I'm sorry to every psychiatrist who's present here. No, you cannot give therapy. You can only prescribe medication. Like we cannot give medication, but we can only give therapy. So we have to be together in this, and we need to understand where our limitations and strengths are. So whoever your psychiatrist is, please continue with the medication, but along with that, take psychotherapy. That is where your
ma'am,
solution lies.
sorry to cut you off. I
Hmm.
have been to many psychologists, like
Hmm.
uh, 6 or 7 psychologists,
Hmm.
uh, but uh, the very disappointing thing is, I don't know. Even in I went in Islamabad, there was a very
Hmm.
renowned psychologist.
Huh.
The very disappointing thing is that when I went there,
Hmm.
they said, some of them said that you can't be treated because I have some other. I don't know whether to mention, but it's a psychological class, so I can mention. So I have some kind of suicidal attempts I did. So they are
Hmm.
like, we can't treat you. We can't just treat you, and they were just providing me counseling. They were saying that we can provide you counseling for your personality. Like I have some other issues, but we can't provide you therapy for your these issues. So that was so much disappointing for me, and unfortunately I cried a lot, and I have to help myself with my own. No one was there, so I have left with a psychiatrist only, and his medicine. So
I'm really
that's
sorry, Saida. I don't know what kind of people you went through. I mean, with all due respect to them. Suicidal tendencies, this is the nightmare of any psychologist, and that is the first tendency that we check whenever a client comes to us. That is one of the basic principles that we follow. And if the client is suicidal, yes, what we do is that we have to inform the family, because someone has to take care in order to ensure that no such attempts are made. This is what ethical principles ask us to do. But then to say that PTSD, social anxiety, and these suicidal tendencies, even if there have been attempts in the past, they cannot be dealt with therapy is not at all something that I agree with. I don't know your full medical history. I don't know exactly where these statements are coming from. Maybe they know much more about your case than me. But whatever has been told to me as of now, I won't agree with the statement that you cannot be helped through therapy. You can be helped. Maybe the people you are going through, they might be having certain reservations or whatever it is. But these are very normal and these are very common cases. I'm not demeaning your issue, but I'm telling you that these can be dealt with. And you definitely need therapy, psychotherapy, and with the right kind of a psychotherapist and with the right approach, right therapy, the fit between the client and the therapy, you can be helped a lot.
Okay, ma'am. Thank you so much.